Hello guys, good day for everyone. This is Miss Lovely Gan Ortiga. My profession before is I am 16 years expat model around the Asia and some other country like London and Singapore I base for expat magazine, hotel and restaurant. So now I'm stable here in the Philippines doing for business traders. I've been searching a lot of people in the YouTube because, you know, being also a vlogger, you know what, good for me. So, long time and compare, and also a lot of doctor surgeon in Manila also is my friend. So, I chose Dr. Cortisa because what I can say is very good, very legit. My product is legit doctor for any procedure about beauty, okay? Okay, our concern for today about the eyebrow. So what is that? Is the octo twist about my eyebrow. So we gonna do the procedure for today. So samahan natin kami ni Doktora for this procedure.
Good day everyone, welcome to the CSA Medical Aesthetics. Dr. Contessa here, your certified aesthetic physician. In today's episode, we have a new guest. Let's all welcome Miss Lovely Gan Ortega. Yeah. Welcome, ma'am.
Thank you, Doc.
Yan. And we're so happy to have her, and I think you have a lot of vlogs also regarding beauty, right?
Yeah.
Yes, and that's wonderful because in today's episode, it's like a continuation of our previous episode with a topic on Asian brow lifting and also the lateral brow lifting using cog threads. Okay, so I'm also excited because this is a continuation of the discussion in that episode. And what we did previously was more of the lateral brow lifting to make that foxy eye effect. Fox eyes or cat's eye, right? And I think we were able to deliver that whereby we lifted on the
Lateral.
exactly. And the purpose is to lift also those with the hooded or droopy upper eyelid. And also to give that space for, you know,
open wide po.
Exactly. For those people who wanted to do eyeshadowing, di ba ma'am? Pagka gusto ng mga different colors of eyeshadows and then you wanted to have extra space for that, you can do the foxy eyes or the cat eye effect using cog threads. And in today's episode, we'll be using another type of PDO thread called octo twist, because I think I mentioned that. So we'll be using the octo twist particularly again on the lateral brow to give that lifting, skin tightening, as well as like a volumizing effect. For some people with sunken temple, we can make use of a volumizing PDO thread, the octo twist. Okay, and also we'll combine with the medial aspect of the eyebrow. We'll be doing also a lifting here. Okay, and we'll be using cog threads there. So here, medial brow region, and also the center with the arch of the eyebrow. We'll be doing those lifting. Kasi ma'am, right, as time passes by, you'll notice na parang nagiging heavy na yung upper eyelid. Napapansin niyo po ba yon?
Yeah.
So dito sa area na to, as time passes by, lalo na yung eyebrow region or upper eyelid, some people are noticing it's going down or becoming droopy.
The fat pad kasi, Doc, nagda-down sila.
Yes,
no?
it
Upon
sags.
aging.
Right.
Yes, about my age like that.
How young are you?
Oh my God! And I am a woman going to 50s. Look at that.
Oh, di ba? She still looks young. Okay. Pero do you also notice na po, parang itong side na to,
Because I'm not really person na nagmi-makeup, Doc.
Yes.
So I don't know makeup, and also I am half Chinese. My eyes is too much small.
Yeah.
And that's why I put always glasses.
Yeah.
So always makeup artist doing my face,
Right.
So lipstick and this one lang I'm always doing.
Of course, we
So I
women.
ignored everything. There's just a kilay talaga is life, yeah.
Kila is life. Especially right now, we were talking about like this time that we cover our lower part of the face and it's the upper third that's being seen. So yung eyebrow, your eyes are the ones being seen right now.
And
So,
also the nose, Doc.
yeah, yung upper part ng nose, yung
yeah.
radix, nakikita yan. So most of our topics are on the upper third of the face right now. We're doing also periorbital rejuvenation. So this is part of the treatment around the eye region to correct also the droopy eyelid, upper eyelid. Okay. Excited ba tayo, ma'am?
Overexcited, Doc, because alam niyo naman, ang hirap ng ginawa kong pag-search sa inyo lagi. Sa daming doktor na, ano natin. So,
Yeah.
always go to the right
Exactly. Yeah, kailangan po talaga you do a research on the doctors who's gonna do the procedure. Make sure that they're qualified, certified. They are really professionals. And also, they have done trainings on these ones. Okay, kasi we
Good
continuously do our training, seminars, workshops. We perfect our skills. We keep on studying.
Yes.
Okay, very important ang safety. Kasi right now, I've been seeing, I think I've mentioned dun sa isang episode, na sometimes pa, they're doing PDO threads or even the non-surgical nose lift. Take note, these procedures are blind procedures, Doktora.
Yes.
Unlike in surgery, ang surgeon ino-open. So the surgeons can see yung mga structures
Blood
like your
vessels.
blood vessels,
Yes.
nerves. And this one kasi, minimally invasive, hindi mo nakikita, ma'am. It's a blind procedure. So it's important that the doctor knows the anatomy.
Yes,
Anatomist din tayo.
Yes.
And we have to know where the nerves are, where the arteries are, and we have to avoid those.
Yes.
And which anatomical plane should we put the product, right? So, yan. So, thank you for the reminder kasi safety is important. So,
Very
you just,
important.
exactly, don't just poke on the face kasi non-doctors, non-medics, nag-inject sa mukha.
Yeah.
They don't know. Di ba? Meron pa ako nakita, yung may DIY pa na injecting the lips with the filler. That's scary po. Yeah.
A lot
Very
I see.
scary.
Mm-mm.
So, very, kailangan, safety is important eh. Kaya, ingat-ingat. Tsaka mukha po yan. Isa lang ang mukha. Isa lang ang mukha. Don't experiment on your face. Don't just poke anything on your face and it's gonna be very dangerous. You don't want to experience any worse complications. O, ayan. So, ating abangan, ano po ba ang procedure, anong technique ang ating gagawin sa pagbabalik ng CSA Medical Aesthetics. Back mga ka-CSA, so we're now at the actual procedure for our brow lifting using our PDO curb threads and PDO opto twist. So I'll be starting with the medial portion. So we wanted also to lift the medial eyebrow and then later on the arch of the eyebrow and then the last one will be the tail of the eyebrow. So with any procedure when you do on your face, you have to start with sterilizing the region. So you have to follow the asepsis, anti-sepsis rule. And then after that, you can do your injection of your lidocaine to numb the area. So I did my markings a while ago, so I followed my markings. I'm just gonna be adding a little bit of my lidocaine injection, particularly on the entry points. So when I do my cog lifting for the forehead region, my entry point will be on the hairline area. So for example, this is my first entry point for lifting the medial brow region. And then for the arch of the eyebrow, so on the right side here, my entry point here. And on the left side, entry point here. And then you can follow the markings you did, follow the path, and you can inject your lidocaine. So you'll expect some blanching on the skin once you have injected your lidocaine. And then for my octo twist, I will be using it on the lateral or the tail of the brow region. So entry point will be here. There will be 3 entry points for that. You can actually use 3 octo twist here to about 5 octo twists, so depending on the problem. If you need more lifting, more strengthening, you can make 5 octo twists here. So for Ma'am Lovely, we can make use of the 3 octo twists, because actually her brow is still very good, so there's still that strength there. So we can use the octo twist to also prevent. This is also for prevention, right, Ma'am Lovely?
Yes.
Yes.
Thank
Okay.
you.
So I'll be injecting a first entry point here for the lidocaine. So as for those who's asking like what will be the distance, so this is like a 0.5 to 1 cm distance. Okay, so same thing on the right side here. So Ma'am Lovely is so relaxed. She is used to procedures already. She's maintaining, doing a lot of skincare, right, Ma'am Lovely?
Yeah.
So she already knows the procedure. So for your medial brow lifting, I'll make an entry point here. Okay, you can use a gauge 19 or even a gauge 18 needle. Then I'll start with my PDO 60mm cog thread here. So once you have your entry point there, which you punctured with your gauge 19 needle, and then just follow the line, the markings you did, and then just insert. Okay. Now, anatomical plane, you should be on a deepest plane. Okay lang, Ma'am Lovely?
Yeah, no problem.
Okay. So, I'm just gonna be very gentle for Ma'am Lovely, okay?
Yeah.
Then next one, for this side here, so I'm using a cog 60mm. Okay. So, anatomical plane is a deep plane. Okay. So, take note of your vascular supply in this region. So, we know that we have the supratrochlear and supraorbital vessels here. And then my end point is there already and pull out. Okay. So, for my next, so I wanted to pull the arch of the brow here. So, I'll make my entry point here. And then I'll use my 60mm cog here. So I palpated for the supraorbital notch a while ago. It's in this region, so I will have to be very careful in that area. And inserting only and towards the brow region. Okay, and pull out. And then next, so anatomical plane, again, you're on a deep plane. Shouldn't be superficial here. You don't want your cog threads to be very visible on the superficial layer. Okay. So we're doing the lifting like that. And then on the other side, again, your entry point. Here. Good thing Ma'am Lovely is not a bleeder, so...
Relax na relax si Ma'am Lovely.
Yeah.
Exactly.
That was more painful.
Inhale, exhale. Okay. So this part, you're pulling also the arch. This is very important for women to have this angle here. So we wanted to have that certain arch angle. So the others wanted a straight lang eh. Pero for women, it's more beautiful if there's this angle, right? Di ba, Ma'am Lovely? Medyo malalim lang po. It's just a deep plane. Pressure, you feel some pressure there.
A little bit.
Okay. Okay. So after that, so you have this cog here, then we'll be cutting the remaining threads. So make sure there's no thread sticking out from the entry point. There you go. So we'll proceed with our octo twist. So after doing a cog lifting on the center part of the forehead and as well as the middle part of the forehead, So we're gonna proceed with the lateral aspect. So we're gonna do the octo twist lifting here. Okay, so we'll make an entry point portion here. I can do like a 4 octo twist here. So like this is 1 entry point here, and then exactly at the tail, entry point here, and then here, entry points, and then another one here. Okay. So the good thing with the tail of the eyebrow, so we're avoiding the supraorbital and supratrochlear vessels there. So we have now the octo twist. This is how the octo twist looks like. Okay, and it's like a combination of all those mono threads in a braided form. Okay, and it's a thick type of thread. Okay. So I'll make my first entry point here. So I'm using a length of a 50mm cannula with 70mm thread. So I'll start with this, and then the vector will be going diagonally. Okay, so you can do that. Okay, lang, ma'am. So once you bridge the end point, which is the hairline, okay, pressure lang po, and then you can already pull it out. Okay. Next will be about 0.5 to 1 cm lateral to that. So this is like using a braided type of thread. So some resistance up to the hairline region, and then pull out. And then next, so when you do this area, you have to make sure that you see all those, or avoid the vessels. So at this area we have some so-called sentinel veins. One more. So I have avoided the sentinel vein at this region. Then the last one. So make sure you have to really disinfect the region because we are in the eyebrow, the hair. Okay. And this is a vertical vector. In terms of your vector, you have a vertical and you have a diagonal vector there. Okay, so we'll proceed to the other side. So proceeding to our left side. So again, make sure entry point is cleansed. So we're using the betadine here. So I'm gonna make my entry point here for my octo twist. Again, this is a long octo twist, 50-70 millimeter. So I'll use my first octo twist here. Okay. And then just on a deep anatomical plane. Okay lang, ma'am?
No
Medyo
problem,
pressure
Doc.
lang po, ha? Some type of a pressure.
Magaan ang kamay niya, Doc.
Thank you. And then pull it out lang. Betadine. Some patients tend to bleed. Then we tell them before the procedure, do not take any vitamin E, fish oils, ginkgo biloba.
C, okay lang.
C is okay.
C kasi A is going to lambot your skin.
Exactly, plus easy bruisability.
Ayoko na nga mag-ink kasi na lumalambot agad.
And then our last one here, entry point. So on the left side, I'm only putting 3 octo twists because I noticed that the right side is more droopy than the left. So you have to balance everything too. So this is my last one and we're done. So we have done our brow lifting using our PDO cog threads and as well as the octo twist PDO. So we did the lifting from the medial eyebrow to this middle part to the lateral part of the eyebrow. So we'll show the result when CSA Medical Aesthetics return. And we're back mga ka-CSA. So atin nang ipakita ang result kay Ma'am Lovely. So ang ating magic mirror, please.
Iwagang salamin.
Yeah.
Okay, dito ako. Wow. So
So the forehead region was stretched,
yeah, stretch siya.
lifted. Okay.
Ako mantay talaga yung kilay ko na.
Yes, because a while ago I
So,
noticed lower ang ating right side than the left side. So we
that's
added
it.
more threads here. Yan. How was the experience, Ma'am Lovely?
So far, wala akong na pain, tolerance.
Okay, yes.
And because of the magic hands of Doktora, wala po tayong naramdaman.
Thank you po.
And then, paalala ko sa lahat, you go to the right doctor, not the wak-wak doctor. Kasi, otherwise, you go wrong, face
Yes,
natin to.
exactly.
Hindi na natin mabalik yan.
Oh,
So, magic hands.
Yes, thank you po.
Thank you, Doc.
And thank you so much, Ma'am Lovely. So,
Yes.
the goal here was to lift our eyebrow and also to strengthen the tissues here. Kasi, Doktora, some people or some patients of mine, they don't wanna do Botox injections anymore. Kasi
Yes.
pag Botox daw, what they experience, lalong nagiging weak yung eyebrow and yung upper eyelid. So, the more it becomes droopy. So, this is already an alternative to the Botox. Those who don't wanna do Botox, para hindi mag-droop, this will be a replacement procedure. Or actually, you can do combination kasi the Botox has also a technique to do brow lifting. You just inject the right muscle. Yun. So, with this one, some of my patients still want to do combination kasi others are asking, Doctor, is it okay to still combine your thread lift with
And the
Botox
Botox
injections?
injection.
Yes, you can still do that with the right technique, right muscle to inject para hindi po mag-droop or saggy yung upper eyelid.
Yes, it's
Okay.
good thing here, Doctor, the thread lifting because of the collagen, new
Collagen.
collagen synthesis.
Exactly.
Yun,
So-
that's makes the skin tighter and parang mag-lift talaga.
Exactly.
For
Because
youthful.
these threads, take note, they are absorbable threads.
Yes.
And then once they're absorbed, they will be replaced by our natural collagen. So over time then, lalo pa siyang mag-strengthen, lalo pang magta-tighten. So yung forehead ni Ma'am Lovely will become more stretched pa.
Yes.
Yan. And yung mga lines, natitreat din.
Fine lines, yes.
Exactly, yung mga fine lines, fine wrinkles, you also stretch the skin, so naka-correct mo. Lalo na yung mga static lines.
Yes,
Kasi
opo.
the static lines are not really treated by our Botox
Botox.
injection. So you can make use of our PDO threads to really stretch it and the collagen replacement.
Yes, that's
so,
true.
Yan. And you can do balancing. Some people, ang concern lang nila, hindi pantay. So you can also make it symmetrical. So
Yeah.
this is a way to correct those problems.
And instant lifting kasi yan for the thread lifting.
And the thing is, kasi Ma'am Lovely still wanted to retain yung look niya. Hindi naman yung
Opo.
sumobra,
Yeah.
hindi naman yung exaggerated, right,
Yes.
Ma'am? Yung tamang support lang ng saggy tissues. Hindi naman yung talagang yung inakyat mo yung eyebrow. Okay?
Opo.
Yung pinalitan mo na yung position ng eyebrow. Kasi she wanted to still retain yung natural brow position and balance lang doon sa face. So again, we have your proportions, yung rule of ratio and proportion.
Yes.
So everything should be balanced and symmetrical. So far, so good po. Na-notice ko na rin, nag-angat siya.
Yeah,
Okay?
I feel it.
And over time pa, nag-i-improve pa po. O yan, we've shown them new product today, the Octo Twist
Twist,
video.
yes.
Actually, that Octo Twist, it's also a volumizing thread. So, apart from doing a brow lift or lateral brow lift, we also do it for the nasolabial fold here. You can also make use of your Octo Twist to correct deep nasolabial fold. So, anything that's sunken already, we can make use of that Octo Twist thread. Probably we'll do another episode on that. So, abangan natin yan.
Oo nga. I'm very happy, Doc, na I'm here again. I'm back. Madami akong natutunan kay Dr. Contessa. So, you have to subscribe on the YouTube para
Yes.
mga sa learnings, no?
Exactly.
And then, of course, yung mga certified aesthetic physicians natin, dapat dun lang tayo pumunta.
Thank you, Doc. So, if you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Derm Centre, or Instagram, CSA Derm Centre. Our new clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong, Maragol, Angeles City.
Yes.
Contact numbers 0933-860-9193 or 0917-504-4268. Yun nga nabanggit ni Doktora, yung mga iba pa nating mga videos.
Yeah.
Abangan nila or panoorin nila sa ating YouTube channel,
Yes.
Contessa Salvador. And paki-subscribe na rin po. And I think, Ma'am Lovely, meron
Oh.
din po siyang mga vlogs.
Vlog niya.
Infos.
Yeah, Miss Love TV.
So, if you wanna see pa yung
Mix.
improvement. Exactly. Yung improvement sa face ni ma'am. Kasi we're taking good care of Ma'am Lovely here.
Yeah.
Of course, ginawa natin yung upper third. Dapat na-maintain natin yung middle, yung lower third. So, abangan nyo rin po siya sa kanyang YouTube channel. Okay?
Yeah. Thank you.
Yes. Thank you so much, Ma'am Lovely.
Thank you, Doc.
Thank you, Doctor.
Doc.
Thank you din po.
And thank you sa inyong lahat. Stay safe. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.